In Focus, health correspondent Linord Moudou now joins us. Linord, we understand Nigeria's battle against polio is getting high marks from a well-known philanthropist.
That's right, Vincent. U.S. software mogul Bill Gates is applauding Nigeria for its success in increasing polio vaccinations and reducing the incidence of the paralyzing infection. During a visit to Abuja, Gates said Nigeria must continue efforts to eradicate polio to guard against future outbreaks. Gates says his foundation is pledging an additional $115 million to the global polio fights. Thousands of people are gathering here in Washington for the second Women Deliver Conference. Participants including midwives, doctors, elected officials, and Hollywood stars are attending the three-day event. Women Deliver works globally to generate commitment and investment for fulfilling Millennium Development Goal number 5 to reduce maternal mortality and achieve universal access to reproductive health. The theme of this year's conference is Investing in Women, It Pays. UN Secretary General Ban Ki-moon opened the conference on Monday with a personal story.
I myself was born at home in a small village in the Korean countryside. I remember as a child asking my mother why women who were about to give birth would gaze at their simple rubber shoes before they went into the room to give birth. This is Joint Action Plan, our plan to accelerate progress on women's and children's health, our plan to help us meet the Millennium Target goals by 2015.
And I asked some of the participants why they are attending the conference and what they expect to gain from it.
We are working in the safe motherhood domain, so Women Deliver is an opportunity to meet other participants and to share experience, what people have been doing about women issues, and to deliver also some solutions to improve women and girls' lives.
Nigeria is a country that has immense material and human resources, and sadly we have one of the highest maternal mortality rates in the world, second only to India. And India, that is so because of the population. It is very sad because we believe that no woman should die giving life to another person. We have the resources, we have the human capital to be able to make a change. What we need is the political will for those who hold the purse strings of government to put the money where it is most needed, at the primary health care level. Because without the infrastructure, we will not be able to deliver health.
Well, I'm here in the Women Deliver Conference because, as you know, the maternal mortality problem, women's rights and all that affects many countries around the world, especially developing nations. So coming from a developing nation, it's the right place to be. We're hoping that at the end of the conference, we'll be able to have solutions to going around the bottlenecks in reducing maternal mortality, having these women, giving these women their right to the proper care they need. It's not a woman's problem alone. It's the problem of everybody in the community, be it the man, be it the woman.
In many parts of the developing world, unsafe abortions and HIV/AIDS are killing young women. Part of the Women Deliver Conference is the Deliver for Youth Working Group, a platform for young men and women to highlight issues of concern to them. Robert Mukondiwa is a journalist and youth activist from Zimbabwe.
We've always said that the youth are the future, you know, they determine the future. They have to participate in issues that are as important as this, and to make sure that their voices are heard. Not only have something that's crafted by somebody else for the youth, but have them, you know, tailor-make and craft their own future for themselves. You've got issues to do with abortion, female genital mutilation, and all these things boil down to culture and tradition in the various countries, especially in Africa, where these things are rooted in the history and heritage. And we're coming here into the 21st century, and we're thinking some of these things have to be revisited and revised. Those are issues that show the schism between the past and the present and the future in African societies, the developing world, and these are things that the youth need to sit down, talk about, and devise strategies on how to go forward.
And that's your health report for today. Back to you, Vincent.
And we want to thank you very much, Linord, for joining us today. Remember, Linord Moudou joins us every Tuesday and Thursday for the latest health news in Africa, right here on In Focus.